New York State Department. Okay. Let's go ahead and listen to this, and then I'm going to ask you a few questions.
Talk about New York State numbers and that the vaccine is safe and effective. How do we know that? Because if no cases are being reported to you guys of fully vaccinated patients who are coming in with COVID, then how can we make that claim? Because I can tell you, we just lost a guy the other day to COVID pneumonia. He died, and he was fully vaccinated in March and came in with severe COVID pneumonia and died in our ICU. So, I mean, that wasn't reported to you guys. So how can you claim as a state that they're safe and effective when hospitals are seeing this and you guys aren't made aware? Because there's no mandate to be made aware.
Right. It's not a state claim, though. That's also something that's federal, but I understand what you're saying. But that's why it is important. We do want people, we want all the providers to be able to report this, even if it's not mandated. We do want to, because that's the only way that, like you said, this will be able to be found out.
But there is no education. Like I said, it's the only education we're receiving is how we're supposed to be pushing the vaccine. But there's no education about what to do when a patient has a problem.
Deb, I feel you, and I really do appreciate your work, and I hope you continue doing it. Because even though it's not something that I could say at this moment that I know for sure that it's mandated, because that's what I'm being told, that it's not, at least not in the way that unless they're an actual vaccination provider that was giving out vaccine, the enforcement is not there.
So why were you reaching out? To try and say, why are you not getting more doctors and nurses to fill these things out?
Right. I had actually first written a couple of emails to the FDA because this is all new to me. I didn't know what I was supposed to be doing, but I knew what was happening was wrong and needed to be heard and told.
Right.
Because my duty is always to my patient and doing the right thing. So I wrote a couple of emails to the FDA alerting them of what was going on, thinking that they were going to get back to me and we are going to have some solution to this problem. And I heard nothing back. So then again, I then reached out to the State Department of Health and said, hey, can you guys help me out? Can you help me understand what's going on here and who am I supposed to be reporting to? And like I said, they really weren't terribly helpful either.
And it's weird because it's like she's repeating what you're saying, but doesn't really want to do anything. But yeah, no, you're right. I know we're, really it should be done. We're not going to know how many injuries there are if people like you don't do it. And you're like, but why then aren't you having a program to teach us to do it? Like, right? It makes perfect sense. You saw a need, right? I mean, that's what a good employee does. You see a need. We have a problem in this hospital, doctors and nurses. And I'm assuming then you reach out to the State Department thinking this must be happening in every hospital, because if they're like me, I didn't know about VAERS. And so we're telling people the vaccine is safe and effective, but how will we come to that determination if nobody's reporting the injuries that are actually happening?
Correct.
What did you feel like when you would get done with a phone call like that? I'm sure you're having many. Like, did you start thinking, do they just not care? Are they stupid? I mean, what runs through your head?
I was frankly just floored. I couldn't understand why, again, if you're going to release an emergency use product that we don't have any really long-term, short-term safety data on an entire population of people that were not represented in the clinical trials, why wouldn't you assure that safety reporting was done, that the people who would be potentially seeing injuries would be educated? Hey, we're rolling out these vaccines, you might be seeing something, these are some of the conditions we might see. Make sure this is what you do. This is what you do. You report to VAERS. Wouldn't you want that? So it was mind-boggling to me. I mean, it's funny. I tell one of my colleagues all the time, an average day, I think I'm crazy. I'm going crazy because I'm like, why doesn't anybody else see this? Why is it so difficult? It just seems like it's just the right thing to do. We're healthcare providers. Our first duty is to do no harm and to assure safety for our patients and our communities. That's what we do.
So you start filling out your own, and you're filling out those from people that are just like, I'm too busy, or I don't want to deal with it, I don't want to figure it out, so could you just fill them out? So then so as you said, you took up a whole week trying to fill those out. Did anybody tell you, like, was there anyone on staff that said, as your friend, I'm not sure that this is a good idea, like this might get you in trouble? Were you under the impression this hospital is going to support this work?
Yeah, I thought I